So I'll go ahead and introduce myself first. My name's Lindsay Fujimoto. I'm an associate director here in the Northwest chapter for the Crohn's and Colitis Foundation, and I'm joined by Julie.
Hello. So I'll take it from here. I'm Julie Rommel. I'm here because my uncle, my daughter, and I have Crohn's disease. And when my daughter was just 19 years old and suffering miserably, when I couldn't ease her pain, I decided I wanted to be part of the solution. So I joined our local chapter's board of directors and have done that ever since. So the reason I'm here today, however, is that I believe it's vital for those of us who are living with invisible diseases to not feel or to feel more visible. So for those of us who are living with inflammatory bowel disease, our experiences with rapid onset of diarrhea, excruciating pain, weight loss, weight gain, fatigue, and sometimes depression, anxiety don't make for great cocktail party conversation. So the more that people like us can demystify it, and it'll help people get diagnosed sooner, which will lead them to get treatment faster, and then ultimately into remission, because these diseases as of today are chronic and incurable. So that's why I am here to talk about what the Crohn's and Colitis Foundation does. So Lindsay, can you advance? Okay, great. So our mission is to find cures for Crohn's disease and ulcerative colitis and to improve the quality of life of children, their caregivers, and the healthcare providers who are all affected by these diseases. The Northwest chapter is based in Seattle, and we serve a very large geography that covers Montana, Idaho, Washington, Oregon, and Alaska. Next slide. So inflammatory bowel disease is also known as IBD. It's an umbrella term that includes those two diseases, Crohn's disease and ulcerative colitis. They're currently, as I mentioned, they're both incurable and chronic that cause inflammation in our gastrointestinal tract or our GI tract. As we say, it can affect patients all the way from their mouth all the way down to our rectum. So after the foundation has been studying IBD for about 30 years, what we know is this: nearly 1 in 100 Americans live with IBD. That means in Montana alone, there are some 11,000 Montanans with IBD. So if you think about your circle of family and friends, there's a good chance you know somebody with IBD. It's often you don't know that because, as I mentioned before, nobody likes to talk about it. Also, people are typically diagnosed between ages 15 and 35, but unfortunately, our fastest growing population are children 18 and under. And equally as sad is that they typically have the most extreme cases, and it seems like they keep getting younger and younger. The average IBD patient typically is misdiagnosed twice. And for my daughter's situation back about 10 years ago, it took nearly 6 months and 25 pounds of weight loss and her inability to work, to go to school, to finally get diagnosed. So it's an unbelievable journey for many, many patients. The other thing is the exact cause is not known, and it affects a wide range of population. It's, a lot of people think that it's, narrow and that it affects Ashkenazi Jews or Caucasians, but we see people of color continuously being diagnosed. Again, the causes are unknowns, but we do know that it is caused by an interaction between genes the immune system, and environmental factors. And there's a lot of research underway to better understand what those environmental factors are. So the next slide. So the Crohn's and Colitis Foundation is a nonprofit, and we were founded in 1967, and we have played a role virtually in every single major breakthrough in IBD research. We've invested $500 million towards finding cures, and we say cures because it's Crohn's and ulcerative colitis, treatments, diagnostic tools, as well as cures. I have to say that we are the most trustworthy source for all things IBD. There's a lot that we do to advocate on behalf of patients, and we do a lot to protect the access to care and try to keep the costs for treatments down. So for instance, the foundation was instrumental in getting step therapy passed in nearly 40 states. And for those of you guys who may not know what step therapy is, it's considered fail first policies if they're insurance policies where patients are forced to try and fail lower cost medications before insurance company will pay for treatments the doctor believes is the right treatment for patients. Unfortunately, as of today, Montana doesn't provide those protections. So we're hoping that as time goes by that we can fight for those protections here in Montana. The next slide, and I think I transfer it, or I'll give it to you, Lindsay.
Yeah, so within the Crohn's and Colitis Foundation, we have a lot of patient resources. So we provide information and education both virtually and in person for IBD patients and their families. And we have these on a variety of different channels at both the national and the local level. So we have webcasts and printed materials that all provide accurate and up-to-date information for folks. Also on our website, you can see captured here. This is under the patient and caregiver tab. You can find numerous helpful resources to help you navigate IBD wherever you're at in your journey, whether you've just been diagnosed or you've been living with IBD or caring for someone with IBD for years and years. This also includes our mental and emotional well-being resources. So if you click into that on our website, you'll find this page entirely dedicated to mental and emotional support because we know how critical mental health and emotional well-being can be for our IBD community because these diseases can be so isolating and challenging to navigate. So you'll find here resources that are tailored to our community that's focused on depression and anxiety, managing the physical symptoms of IBD, pain and fatigue, managing mental health and emotional well-being, and also tips for talking to your doctor. So it covers all of these things and more. So we hope to provide as many helpful resources as we can to folks through our website. Also on our website, we offer support programs for patients of all ages and caregivers. So one resource includes our IBD Help Center, which you can see on the screen. This is where you can get personal answers either by phone, email, or chat from an IBD specialist. And we also offer support groups. So our IBD Help Center can help you find specific resources, refer you to other organizations, help you understand health insurance coverage, and more. So folks can reach out and receive one-on-one support from our help center there. With our support groups, we have numerous support groups offered nationwide, both virtually and in person. So here in the Northwest chapter, we have a number based locally here or facilitated by local volunteers. So we have our Black African American patient support group, our Bozeman patient support group, Caring for Caregivers support group, which is for both parents and caregivers, just to name a few. So whatever support groups people feel is the best fit for them, they're open to whoever and on whatever frequency they feel is best for them. So,
and Lindsay, let me add one other thing if I can. We don't have a lot of support groups throughout Montana, but our chapter is full of individuals who would be so happy to provide one-on-one support and answer questions. So that's another informal way to connect with those who really want to find others like themselves.
mm-hmm. Yeah, and like Julie mentioned earlier, with pediatric patients being our fastest growing population of IBD patients, we have numerous pediatric specific patient resources that can be really helpful for kids and teens and also their parents and caregivers. This includes our teen website and college website, which is really helpful for kids as they age with IBD and also making that transition from pediatric to adult care and from high school to college, that sort of thing. So we also have a really exciting program, Camp Oasis, which Julie's going to share more about. But this is our 1 week sleepaway camp for kids with IBD, which can be a life-changing experience for campers and their families. I'll pass it to you, Julie.
So Camp Oasis is awesome. The mission of our camp is to allow children with IBD to feel like healthy kids by providing them a safe and supportive camp environment with kids just like themselves. So many of them attend Camp Oasis because traditional camps aren't able to provide the support and care for kids who have inflammatory bowel disease. So what Camp Oasis does is it uniquely allows patients to improve their confidence and social skills, develop their first IBD peer community, and learn to independently manage their disease, which is really huge because many have to use injectable subcutaneous type of treatments at home. So it's such a great place for them to feel like they become their own IBD superheroes. But even more importantly is that it's a sanctuary for kids to just have fun and simply be kids. But for those who aren't ready yet to go to sleepaway camp or who can't get there in person, we also offer a virtual program. So, and the success rate and the feedback we get consistently is so positive, and it helps kind of set them off on a firmer ground along their IBD journey. So kind of to bring us home, Lindsay, I'll let you wrap up.
Yeah, and one thing that I forgot to mention about Camp Oasis is that we feel really strongly that any kid who wants to go to Camp Oasis should be able to go to Camp Oasis. So we do offer financial aid, sponsor or scholarships for those, especially who are traveling from far distances. So, for example, our Camp Oasis Northwest chapter camp is in Washington, but for campers from Washington, they can certainly apply for that scholarship to be able to make it to camp. So we try to make that as easy as possible for anyone who wants to attend. So,
and we have, can you remember how many camp locations we have across the United States?
We have 10.
Okay, so there's other options available to families too.
Yes. Yeah, so just to kind of wrap it up, we wanted to thank you for the opportunity to present to all of you and just offer ourselves as resources. Both Julie and I are welcome to reach out to us anytime. And we're always open to new folks who want to get engaged with the foundation And of course, the foundation is always here as a resource for patients and their families, healthcare providers, and anyone else who's affected by IBD. So you can find more information on our website, but you're also welcome to reach out to us directly. And if we don't know the answer, then we will find someone that does. Yeah, so Camp Oasis at Home is our virtual camp option for those who either can't make it to camp in person or they don't feel ready for it yet. This camp is typically around June or July every year, and it's offered to campers nationwide. So when you do apply for this camp, you still get if you apply by the deadline, you can get like your own camper camp in a box thing that includes all of the crafts and everything that you would get at like in-person camp. And they have like virtual counselors. And so making it just like a virtual camp environment, kind of like a virtual clubhouse and everything. So we have a lot of younger patients that do this option and also folks who are unable to travel due to their illness far distances. So that's available to all campers, I believe, between second grade and 12th grade.
There's a lot of resources on there. Starting with under patients, it explains what Crohn's disease is, what ulcerative colitis is, questions to ask your healthcare provider. But then there's also a list of our professional member physicians. So that's another resource of people who are connected to the foundation and typically go participate in our education program. So it's a great starting point.
We also on our website kind of talk about what are some of the very common symptoms of IBD and what sort of things that you should look out for, and just make sure to ask your doctor about if you're experiencing. So this can be a number of different things, but we outline all of that on the website, and just we really encourage that just open communication with your doctor about any concerns that you have. Yeah, yeah, there's signs to look for patients of all ages.
But we do offer free brochures to our community, and they're easy to access. You can contact, I guess I'll start with Lindsay, but everything from nutrition to helping students with their, what do they call them, plans, their 501 plan. 501 plan. I mean, there's a lot of resources and free brochures. And the nice thing that I have to say is when I have gone into many doctors' office, a lot of their brochures are from pharma, which are helpful, but clearly they're promoting their treatments. So that's why I keep saying the Crohn's and Colitis Foundation is the go-to source for credible information, and we do have free resources.